My name is Dr. Divya Balakrishnan, and I work as a dentist here in Saskatoon. I do a large range of procedures, including fillings, crown bridge, Invisalign, which is like teeth straightening, as well as we offer cleanings and checkups for new patients. That's kind of what we do on the general aspect of things in our practice. On top of that, I actually own a dental practice, so I wear a couple hats in that. I do some management of staff and also kind of managing schedules and kind of keeping everybody up to date with what the newest things in dentistry are and making sure that we're able to offer the newest and best procedures in dentistry.
My name's Madison. I'm a dental assistant in Saskatoon. So what I do here in the office is assist the dentist with all sorts of procedures, whether it be fillings, root canals, extractions. We do basic orthodontics here as well, so I help with that. Preparing the patients so when the dentist comes into the room, we're ready to go to give the best service.
I'm Perry Kurtz. I'm an orthodontist in Saskatoon. In our office here, we do obviously orthodontics, which is straightening teeth. So that's our specialty. And as the orthodontist, I'm in charge of looking after the patients, figuring out their treatment plans, and instructing the staff as to which direction we want the work to go so that we can get the patients the best result we can give them.
My name is Debbie, and I'm an orthodontic assistant in the Saskatoon area. My job is to be Dr. Kurtz's hands. We always laugh and say he's the brains of the operation, we are his hands. So I'm taking molds of teeth, I'm taking scans, I'm taking changes in arch wires. Whatever he would like me to do, that's my job.
A typical workday in our dental clinic is when I come in, I usually have two main, chairs that I have to worry about. One is my hygiene chair and one would be my treatment chair. My hygiene chair, actually my hygienist would run it and they do the cleanings, and I would have to pop in whenever I have a minute to do the checkup and make sure that everything is okay with that patient's in particular's oral health. My second chair that I run would be the treatment chair. So those are the chairs that I would actually do my fillings, my crowns and bridges, the Invisalign, whatever is actually scheduled for the day for dental needs.
I like to come in about half an hour before each patient or before my first patient so that I have enough time to be prepared for them, to make sure everything's ready to go. I also take a look at not only our day ahead, but the entire week to make sure that we have everything we need here in office. Once I feel prepared, I start to set up the entire office. So we get our sterilization area ready, setting up for our first few patients as well, just so we're kind of staying on top of everything.
During the day, obviously my job is to supervise over the patients. I want to see the progress each patient has done, and I'm lucky enough that with my staff, I've got a fabulous staff, and so with each patient I sit down, go through, see the progress they've made, and then I prepare the work that's to be done that day, and really the staff become my hands. So I tell them what to do, they do the work for me, and then I can, of course, move on to the next and repeat it.
On average, I will see about 4 patients an hour, maybe 5, depending on what needs to be done. And Dr. Kurtz, we have 6 chairs going in the office, and he floats between all of those chairs and basically just lets us know what we need to be doing. And there are 2 of us in here, and we just basically follow each other around, helping out where we need to help out.
When I was in high school, I decided to shadow in a dental office for a day. And right away, I kind of just fell in love with it. I initially wanted to be a dental hygienist. It is a very competitive area to be accepted into. So a lot of people start by doing their dental assisting, using that as a stepping stone to then get into dental hygiene. I got accepted into SciAst, which is now Sask Polytech in Regina. Right away, I fell in love with dental assisting. I knew that was for me. I didn't want to continue on to dental hygiene.
I was always very interested in healthcare and being in healthcare in some capacity. It probably started because my dad was a surgeon and my sister is also a surgeon. So I was brought up with a medical sort of background. I went directly from high school to the University of Saskatchewan and pursued my first year in arts and science, and learned very quickly that I really enjoyed science, but also the human body. So I ended up pursuing a 4-year Bachelor of Science in Physiology. At this time, I believe it's a Physiology and Pharmacology degree. I was actually waitlisted for medical school, which felt really daunting because that's what I thought I wanted to do, but I was accepted to dentistry. Once I entered dental school, it was challenging because I had the physiology and healthcare background and was doing well and even excelling in the medical school classes, but I found dentistry very challenging, but I really enjoyed the hands-on nature of it. It was very cool to see that progress during dental school. And I'm very happy and honored to be a part of the profession now.
What piqued my interest in orthodontics was actually I was lucky enough to have a cousin who was an orthodontist in Beverly Hills. And initially, when I was in grade 7, I wanted to be a pharmacist. And my cousin came home for a visit. We sit down and have a good chat. And as an orthodontist, he loved his profession. So he sat down with me and started explaining about what he did and the career that he had. And he really influenced me to kind of look and change my career path. Through the rest of school, through high school, what I concentrated on was obviously doing my sciences and maths to prepare. And with the whole idea of going to university to initially become a dentist and then onwards to become an orthodontist. When I went to university, it was 2 years of pre-dent and then 5 years of dental school. After I graduated dental school, I did a 1-year residency at the University Hospital in Saskatoon here, and then I went into private practice as a general dentist for a year and applied to go back to school, and I did 2 years of postgraduate studies, and that's where I became or attained my orthodontic diploma, and started my private practice in 1988, and I've been going strong since.
How I decided on that career was it was a 1-year program, and it still is, but it was something that I thought at that point I could get my career started very quickly and get into the workforce. I liked dental assisting because when I had a lot of time at the dental office when I was younger, and they were always so nice to me. After I'd done my dental assisting, I wasn't sure that was what I really wanted to do. So I just happened to fall into orthodontics. And I started in Swift Current, and I loved it. It was hands-on training at that point. Nowadays, it's not. You have a module that you have to take on top of that. But it was hands-on training, and I just loved being able to work with each of the kids as they came and develop that relationship with them.
Any student going through high school that might be interested in dentistry or maybe more specifically orthodontics, most of us see our dentist regularly, and so my advice would be when you go in to see the dentist, just kind of quiz them. Ask them what their professions are like. Do they enjoy it? Do they have fun in their job? Because to me, the biggest part of career is enjoying it and having fun. And so don't be scared to ask the dentist when you go in. Same thing with the orthodontist.
A career in dentistry can be very variable. There can be a dentist, a dental assistant, a dental hygienist. When I was in high school, and even honestly when I was in university, I didn't actually understand the difference between them, and I didn't know what a typical workday looked like. So once I started getting interested in dentistry, I actually reached out to some dental offices to shadow. I was able to go in and actually watch some certain procedures.
I know lots of post-secondary schools do have open houses, and they're a great idea or a great way to go out and see what programs are right for you.
I think to have a position like this, you need to actually be a very well-rounded person. You need to be friendly, you need to be outgoing, but you also need to be caring, and you need to think about other people and how whatever you're doing is making them feel.
Certain qualities that a dental assistant should have are things like being a good multitasker, working well alone, but at the same time working well with a team. There's lots of different situations where you are working with others, but there's also a lot of opportunities that you are working on your own and just taking initiative and knowing when to do that.
You have to be able to interact with people, and that's one of the greatest things that I've got with my job is that I get to interact with people. I get to visit with them, I get to talk to them, and fortunately I get the rewards of seeing the work that we do when they're done. But I think socializing skills is a huge part of dentistry, of orthodontics. So as you're going through school, you know, like I say, study, but also participate in your sports, do social activities, do your dabs, do your extracurriculars, get involved, because that's what everything kind of boils down to after, is being able to be socially interactive with everybody.
Really people that want to help others. That's part of why I do what I do. The days that we have where we get somebody out of pain and they're very thankful, or we help them with an aspect of their smile that they might have been self-conscious about, those are the best days that we have, and that's why we do what we do. So I think somebody who is basically up for the challenge and wants to help others.